Good afternoon. Thank you for tuning in. Once again, we are here on Facebook Live from Henry Mayo Newhall Hospital. My name is Dr. Larry Kidd, and once again, Dr. Bud Lawrence is here with me, Medical Director for our Emergency Department. So I'd like to start off today by just sharing a little bit about some of the people that are behind the scenes here at the hospital. Often you hear of the physicians, the nurses, therapists, lab people that are working here, of course, all clinically oriented in their work, some of which have been here as a guest on Facebook Live. But there are a number of other individuals that are equally contributing to the support of our patients here at the hospital. And a few of those individuals are, for example, in a sterile processing department, we have a number of individuals who are preparing instrumentation for different procedures that we do. They're also reprocessing a number of other types of equipment that are recirculated in order to provide things such as IV therapy to patients and other types of devices. In addition to that, our housekeeping team, these are the individuals that actually, especially in this time of having a virus like COVID-19 in our midst, they are responsible for doing thorough cleaning of the various rooms that patients might receive treatment in, making sure that all of the kitchen equipment, et cetera, is sanitized appropriately such that we can avoid any contamination, et cetera. So these are individuals, again, that are behind the scenes. And then lastly, our food preparation people. These are the folks that prepare nutritious meals for our patients. They're also providing meals for all of the individuals that are working in our hospital during this time. So again, these are folks that you may not see up front all the time, but they're definitely making great contributions in terms of making sure our hospital is ready and operational to provide care and service to patients at all times. We'll now start with some other updates and answer a few of your questions. Dr. Lawrence.
Thank you, Dr. Kidd. So one of the questions I think that's floating around out there is how many positive patients have we seen here at Henry Mayo? How many positive patients maybe do we have in the hospital? Which are all very good questions. So as you know, for quite some time now, we've had drive-through testing here at Henry Mayo. We're fairly, unfortunately, restricted with our testing. We're really only testing higher risk patients at this time because of limited resources. But we, over the course of this last 3-4 weeks, have found about 77 positive tests. And about 50 of those are recuperating very nicely at home with really no issues. In the hospital, we have about 26 patients who have a positive test, as well as some other patients who are what we would call suspected COVID patients, either waiting for a test or were otherwise concerned that they might have COVID-19. I think it's important to note that, like I said, we really only test high-risk patients. We see about a 16% positivity rate when we test patients here, as opposed to LA County, who has been rolling out drive-through testing throughout LA County. They've been seeing around 8% positive rate. So much lower rate. They're testing patients much less stringently than we are, which is, I believe, why we have a bit of a higher rate. But I think the take-home message is the numbers are not huge. I think that if you look at the math, we're supposed to potentially be in our surge window now. We certainly have seen a slight uptick, but nothing significant, certainly nothing like you see on the news in New York and other countries, thankfully. And I think a lot of that is to do with you guys, our community, you personally doing so well with the stay-at-home and being so diligent. I know that it has its challenges that we spoke about before. But I wanted to thank you for that and kind of just give you an update on some general numbers.
Very good. We've also had questions about children, whether or not we've tested children, if we've had any positive children results, as well as hospitalized kids. And we have, in fact, done some COVID-19 testing on children. Fortunately, we have not had any children hospitalized at our hospital. But we do know in other areas of the country there have been a few. It's not exactly clear, although it appears that children are less impacted in terms of less likely to be hospitalized if they are positive. But of course, if children out there, families see that their symptoms exhibited, that sort of thing, they should not hesitate to also have those kids tested as well. And again, fortunately, we have not seen any kids that had to be hospitalized here.
Thankfully, that's always good. Our kids seem to do quite much better with this, although most all patients tend to do very well with this infection. Here's a couple of quick questions. Someone has asked this question a couple times in a row, so I just want to make sure I kind of touch on it. Why not use cyclosporin for the cytokine storm COVID causes? So this is a very deep question that doesn't really, I don't think you can get into it properly on a platform like this. But just know that cyclosporin, like many of the other medications that are out there, we just don't have the proper data to really push forward using some of these medications until we can make sure they're safe for our patients. We want to first do no harm as physicians, and if we just go kind of jumping after every little thing, there's always a chance we can cause our patients harm. So we're very cautious about that, very intentful in how we address these medications as that we're going to provide to our patients who are sick. And then the other quickie is, will your in-house or hospital lab tests be able to have a quicker result time than what we've seen, which is usually currently now we're seeing about 2 days or so for our lab tests that we send out? Answer to that is yes. We do have a platform called Cepheid that allows us to get test results in about 2 hours. And unfortunately, though, like everything else in this COVID-19 pandemic, these resources are very hard to get a hold of. Supply chains are very volatile. It's a challenge to keep stocked up on these things. We have a number of these tests that we can use, but because we don't know if we'll be able to get any more, we really kind of want to use them very appropriately and purposefully. So we're really looking at using those on our admitted patients so we can get a real quick idea if these patients are sick or not sick and with COVID-19 so that we can continue to treat them appropriately. Dr. Kidd?
Right. We have a question that came in regarding any advice or specific guidelines for African Americans since that particular group in the population seems to be more heavily affected. And that is true. What we see in the way of statistics across the country, depending on the community, there is a higher death rate among those in certain communities that are African American. And it can be as high as, in the Chicago area, we're told it is high as 70% of those that pass away from the virus are African American. One of the reasons for that is many times, especially in the inner cities, African Americans tend to be predisposed to a lot of other healthcare issues. Not only is the COVID-19 virus affecting more of them in terms of mortality, but also the fact that there are higher rates among the population, African American population, of diabetes, high blood pressure, heart disease. And as we know, with the general population, those individuals that have those pre-existing conditions, if they contract the virus, it tends to be much more lethal, so to speak. So advice around, given that consideration, the advice is not a lot different from the general population. So it's equally as important to practice the social distancing, frequent hand washing, very, very critical, and ultimately following the CDC guidelines, given that the more you can distance yourself from contracting the virus, the better off anyone generally in the population is going to be. There are a number of issues that I anticipate after things settle down that will be addressed in terms of the African American population and other minorities in terms of why it is that they're predisposed in such a way that, one, they're less likely to have access to primary care, they're less likely to also have preventative care access and those kinds of things. So I think it's a little bit larger conversation in terms of things that need to be addressed in order ensuring that there's equality among the population in terms of the access to health care and those things that position us to fight off things better, such as a virus when those things present in our communities.
That's a very good point. And I'd also would add to that, with obesity as well, we're seeing a higher incidence of patients who are sick. I've said this like a broken record already, that when the dust settles, we will know a lot more about this disease process. And these are two subpopulations that we certainly need to learn a lot about, and I think that data will be there. The next question that has come up is intercourse. Is it safe to have intercourse during this time period of quarantine and the COVID-19 infection? And I think if you sort of look at this just systematically, if you are quarantined essentially, or you're staying at home with someone that is your partner or your spouse, it's fairly safe to say that both you and that person are in the same boat in terms of if one of you was infected, it's possible or even considered likely that the other one may be infected. So I would say if you have a partner that you're quarantining with or you're staying at home with, I think that should be no risk with that. There should be no increased risk of contracting something other than your daily activities of daily living that are going on. I wouldn't recommend staying away from intercourse if that's your choice. The only time I would recommend that is if you're bringing a new partner or someone that is unfamiliar to your stay-at-home environment. If you were dating or some other example, I would say in those situations that would be not something that's recommended. Just as going out and hanging out with somebody within 6 feet for a prolonged period of time would not be recommended in this time of COVID-19.
Okay, and we're starting to wrap up here. One final question here is the community working with the hospital for additional space to be used in case the hospital gets to its capacity in the next few months? We do work with various other organizations within the community. We share information in terms of what the needs are. Fortunately, here at Henry Mayo, you're probably aware of, about 6 months ago, we opened a 6-story tower, which is an addition to our hospital. So our capacity is quite vast at this point. We actually have previous units that we housed patients in that were to undergo some renovation. Those rooms, those beds are still available at this time. So we've been able to expand quite comfortably as we needed to. So again, we are continuing to operate for a full service hospital. All the services that we were always providing in the past are still available to our community. So we don't anticipate a need, but should there be an occasion where we need to expand outside, we would be working with the various other community agencies and so forth. But we're in good shape right now. But thank you for that question and your concern.
It's excellent. Just kind of in closing, I wanted to thank people, as I seem to probably always do. Thank you so much for staying home. I think that you can see this is really making a difference. If we were theoretically in the surge right now, certainly we're not seeing nearly what other places are seeing. So your work is paying off. Your work is paying off. I would also just recommend that not to put off little things that might come up. So if you're a female or even a male and you find a lump in your breast, or Sheila Vallot's breast center is still open, limited hours, but still open. Same thing if you had a mole or some sort of skin condition that you were concerned about. Always good to get that checked by the dermatologist. What we don't want to have is that everything kind of gets put off because we've been told to stay at home and we're doing an excellent job, and it's something that maybe should have been addressed a little bit early on. I think we've talked about that before. Talked about patients maybe not paying attention to chest pain, abdominal pain, shortness of breath, and when you come to the ER, it's already too late for us to intervene and give our life-saving help that we have. So just please remember that we are still a resource for you here at Henry Mayo. We're still here to serve, and we are still very thankful for all that you do to stay at home and keep us and others well.
And as Dr. Lawrence indicated, we are here full service. As your needs arise for those services that we provide and that may arise even during this time of the pandemic. Our hospital is fully equipped to make sure you're safe when you come to our facility, and so don't hesitate to have your healthcare needs as you would previously. Thank you for your time today, for tuning in, and we look forward to the next session with you. Do take care.
Take care now. Be healthy.